Hello to everyone, I'm Dr. Mehmet Gencer, plastic reconstructive and aesthetic surgeon from Istanbul. Today I want to talking about my three-plane vertical lift. Today we all know we get age altogether. There is no only sagging on the brows, on the lower eyelid or prejowl. Look at these beautiful pictures. We get age all together, brows, infraorbital area, mid-face, lower face. It means not only one surgery solving all the problem, and we know most powerful procedures in the facial rejuvenation is deep plane face and neck lift. But to be honest, deep plane surgery alone doesn't solve everything. We all know that deep plane solving specifically the lower face and the neck very good, but mid-face and the periorbital region, specifically tear trough deformities, infraorbital hollowing, and central mid-face descent. This is really big problem. Deep plane techniques often fail to provide true and long-lasting correction. In this way, for this reason, I don't really on single procedure here. I approach the face through three anatomical planes using one vertical rejuvenation philosophically. This is what I call the three-plane facelift. The first one is upper face. We already published it and all we know forehead lift. Forehead lift is not lateral traction, lifting whole face together without any eye lifting or temple lifting. This is really effective surgery. We're lifting everything together and tightening the scalp. This is a very beautiful results. She came for me full facelifting and I did three-plane facelift. Look at her face. This is after. What is the best thing for her? Of course, upper facelift. This is a forehead lift technique. This is another patient of mine. Look at this beautiful lady. She had a problem here to here, but the biggest reason at the end of surgery she looks amazing because of the lifting upper face, not for the lateral traction, not crazy one. Look at this angle. She looks down, same angle, but the results is shining here. And the other thing, mid facelift. This is where the main difference begins. Deep plane surgery affects the mid-face indirectly, but it doesn't directly address the infraorbital rim, SOOF, or tear trough deformities. And we already published my mid-facelift technique. We use it because I release the mid-face from the orbital rim, reposition it vertically, fixing it anatomically to achieve stable and long-lasting results. Look, we release everything together, making some holes, lifting them up vertically. How it gonna possible? Releasing tear trough deformities. This is our bone under our eyes, releasing it and lifting all this cheek tissue vertically. This is very important. I wanna share something about here to you. Look at this beautiful lady. She came for me for full facelift and I said to her, you have some problems specifically here. Look, this is tear trough deformity and this is mid facelift triangle. These are saggy and she came for me for deep plane technique. Look, deep plane starts from here to here, lifting this part, lifting this part, lifting this part. Yes, most powerful surgery, but cannot reach this part. And we need to lift everything here vertically. When we release these ligaments with my subparietal dissection, we can already lift these things here to here with orbital bone area. And also the last thing, of course, if we lift the brows together, we can achieve very beautiful results like that. When we continue from here, this is our mid-facelift technique before and after. Look at the see mid-facelift effectiveness here to here. For the mid-facelift, this is not a filler. This is not a temporary suspension. This is anatomical repositioning. Look, this is the patient which I showed you before. She had a problem here together and brows. Do you want to see the long-lasting results? We lifted her mid-face vertically, lifting full face with a smash lifting and the brow lift and some touch-ups. I like these results a lot because this is real results. Another angle, we did a dual plane mid-face lift here, deep plane face and neck lift and brow lift. If we see the lateral view, look at the lines 2 or 3 years before, look at these lines now. It's very harmonically. Another patient of mine, she came for me, tear trough deformity and hollow eyes, and then she said, I want a deep plane. I said to her, deep plane cannot solve all of these problems, and we did her a brow lift, a fat transfer, a true vertical mid-face and a deep plane technique. Look at this lateral angle. Look at this part. This is very, very hollow here. Infraorbital rim has a very big problem. Saggy midface, saggy smash, saggy things, and low-seated eyes, hollow eyes, and permanent bone. Now, result is amazing and shine. Why? Because we lifted her midface lift anatomically. This is not a filler, and lifting all the deep plane area like that. If we check everything else closely, we can understand this problem. Another patient of mine, she came for me the revision deep plane face and neck surgery, and I said to her, the biggest problem is here and here, here, and here. We do her deep neck contouring facelift, but the main thing, we lifted her brows vertically and solving this problem with transoral midface technique. Look, we lifted the brows, releasing infraorbital rim, lifting all the midface tissue and lifting smash and the deep neck. And another sample of mine, he came for me, a problem is here, brows and the saggy face. He just wanted to have a periorbital region healing, and we did a true midface lift, deep plane face and neck lift, and brow lift. This is the amazing result that we have. And another patient of mine, look at here, tear trough deformity, saggy cheeks, lower face. Here is the results. We did everything the same. 3 planar midface lift, 3 planar midface lift, 3 planar midface lift. That's all.